Unexplained infertility accounts for about 20 to 25% of the couples we see for infertility, where the husband seems to have normal sperm, the woman is ovulating normally, and she has normal, regular 28-day cycles, and her tubes are open. The treatment of unexplained infertility could be no treatment if the patient is young, because out of all patients with unexplained infertility, almost 80% of them eventually get pregnant either on their own or with treatment. However, if the patient is again over 32 or 33, where she cannot afford waiting for pregnancy to happen, and she cannot afford wasting time, then we need to be more aggressive in that kind of treatment. And more aggressive means either a treatment with fertility injections, which stimulate the growth of many eggs in the ovary, and that is followed by intrauterine insemination, where we take the sperm, process it in the lab, and inject it into the uterus. That will give the patients a chance of pregnancy of about 10%, up to 15% maximum per cycle of treatment. The other option they have is something called the GIFT procedure, gamete intrafallopian tube transfer. This is a procedure where we take the sperm and the egg and mix them together and inject them in the fallopian tube at the time of laparoscopy. Laparoscopy is a surgical procedure where we put a telescope through the navel or through the belly button and look inside. We can pick the tube and inject the sperm and the egg in it. That procedure is extremely successful and gives the patient, especially the young patient, 40 to 50% chance of pregnancy. I have to say, though, that there are a lot of fertility experts who would disagree with this notion of having to do GIFT to treat infertility patients, because they say that we are putting the patient through surgery, through anesthesia, risk of surgery and anesthesia, and it would be better to put these patients through in vitro fertilization. In vitro fertilization is a non-surgical procedure. There is no anesthesia or surgery involved, and will give them almost the same chance of pregnancy as the GIFT procedure. My suggestion is that you discuss with your doctor the pros and cons of both of these treatments. It is my understanding that we are the only program in Jacksonville that offer the GIFT procedure.